Hello and welcome to another episode of The Switch. My name is Patty Hampton and I am excited about this week's topic. Did you know that nonprofit HR has served thousands of mission-driven organizations over the past 20 years? This episode is all about critical steps your organization can take for successful re-entry into the workplace. Listen in as Alicia Schoshinski, Senior Human Resources Business Partner at Nonprofit HR, and Lisa Smith, HR Business Partner at Nonprofit HR, provide insights on strategic workforce planning and key decisions your leadership team will need to make to identify who must return in order to effectively achieve your mission. Share this production in your communities and download the slides and transcript. Visit nonprofithr.com/The Switch for a video recording, presentation, and other assets. Without further ado, here's Alicia and Lisa.
And welcome to all of you. We're glad you're here today. As we know, many of you are just grappling with so much information you've heard about states reopening for business and, maybe your local area. A lot of organizations are anxious to get back to work, but also a little bit fearful of what that means and not sure what they need to consider. So hopefully what we talk about today will help you put together a plan as your organization is considering bringing people back to the actual workplace. And really our goal today is just to help you think through all of the things you need to consider when you're making this decision, and then certainly help you to develop a plan in that regard. So today what we're going to cover is a little bit about the strategic decisions that you have to think about. We will talk about some of the compliance issues, culture and communication, what you need to consider there. And then Lisa is going to talk about safety and physical space considerations. And then we'll walk you through what you need to think through as you're making your reentry plan, and then talk about some key takeaways, and then we will answer questions for the last half. So let's talk first about what you need to think of in terms of your strategy. As I said before, there are a lot of voices out there that are telling you, okay, you can open, you should open, there's this, there's that. You need to really think about that there's not a one-size-fits-all decision. You need to make your decision based on your own situation and the data that you have received. It's a very strategic decision and it's very personalized to your organization. So you need to think about what works for your organization and make your decision based on that.
This event was originally recorded as a nonprofit HR webinar. Check out other nonprofit HR events and virtual learning opportunities at nonprofithr.com/events.
So from looking at your external environment, some of the triggers that you need to think about, it's kind of the first gateway is, are you legally able to open? So is your state, your federal government, or your local jurisdiction, what are the rules in terms of allowing openings? And I know some states have opened much earlier than others, and that can depend on the cases in your organization. It can depend on political factors. So there are a lot of things that go into those decisions, but you need to use that as kind of a gateway of whether you're able to come back to the workplace. And then you need to look at it from the sense of, is it prudent to open your workplace? So really look at the public health data. What is the CDC saying? What are your local public health agencies saying? How are the cases in your area? Is there a downward trajectory of cases and symptoms for 14 days? Are your hospitals able to treat those that need treatment without a lot of crisis care? Are you able to limit the people that you need to come in to those that are just local? So a lot of things you need to think of in terms of the public health situation. And then looking at testing and screening availability, how much testing and screening is available. I feel like that's going to change as we go forward, but keeping that in mind if you do decide to test, which we'll talk about a little bit later, but also just if anybody gets sick, are they able to get tested, and are you able to get that information that you need? And then finally, on the external environment, what protective measures are needed for your employees, such as, whether it's teleworking or are there things you need to do to minimize their contact with others. And then secondly, you need to look at the triggers that are related to your organization, your nonprofit. So look at your business model, your mission, Are you a membership organization? Are you a direct service provider? What do you need to accomplish? Does that require you needing to be in the workspace, or can you do it effectively out of the workspace? And it's important to also look back at what you did during this last, I don't know, 6 weeks, 2 months, however long we've been, a lot of us have been out and really focused on this. How effectively did your nonprofit run during that time? Were you able to meet your mission and do what you needed to do, or did you find that there were gaps in service that you needed to provide, or obviously, you know, there may be other financial concerns and such, but really thinking through how you were able to continue and how you can continue in that same manner going forward if you need to. And then secondly, looking at your constituents and the members and those you serve, you know, are you able to still meet the needs that they need? And as I said before, if you're a social service provider, obviously that might be very different needs than if you have somebody in a, if you're in a regular office setting. And then also just going back to the first point above, thinking about business continuity and sustainability. So thinking about during this time, did you consider what if any of your leaders get sick? Do you have a succession plan in place? If you bring people back, what if your whole department gets sick? So you need to think about those things. Also thinking about cross-training. Those are very important things to think about as you consider your sustainability as well. And then, of course, financial situations certainly play into this. Many organizations are certainly having a tough time during this crisis, and you need to factor all of that in, how you're managing fiscally, is your funding coming in, what things you need to consider in that area. And then there's the area of your physical space, which we'll talk a little bit more about later, but the type of space you have. If you are returning to an open office space concept, you might need to rethink some things there. If you are providing a direct service, there's certainly things you need to think about there. And there may be cost implications as well. If you are paying your rent, if you can operate differently or modify your space, things along those lines. And then other infrastructure issues such as technology, you know, your IT support, privacy, do you have the equipment you need, the security you need? And those things, I think, probably came up a lot while you were out, and people probably learned a lot. So a lot of organizations had to quickly scale up some of their IT and other infrastructure services to be able to allow people to work remotely if they were able to. And so thinking about what you've learned from those situations and if those can continue and what efficiencies you might have gained as well. And then finally, just take a look at your overall risk. So, you know, think about if you're coming back too soon, or if you wait too long to come back, what will happen? So just thinking through all of those things. And as you're thinking about the things your organization needs to consider, make sure you're covering, involving everyone across the organization. So, you know, if you just have a few people in a room making this decision, it's not going to be as effective as if you involve people from across all departments, including employees, to get a sense of their perspective. And that's the next trigger we'll talk about. So we've talked about your external environment. We've talked about what you need to think about internally related to your organization. But then certainly a big factor is how your employees feel in all of this. What's on the top of their mind? We know that a lot of employees are certainly concerned about their health and their safety. You know, will they get sick if they come back to the workplace? Some of them have compromised family members at home. Some of them are caregivers to elderly parents. They have kids at home and have childcare issues. Others have issues and are worried about public transportation if they use that. How will they get to work? How will they be exposed if they have to come back to work? And then I think a lot of people have kind of changed their perspective on a lot of things now that many have been working remotely. Many are, you know, kind of getting used to working at home in some cases. Some like it, some don't. But some are also, you know, maybe will be interested in a little more flexibility than they had in the past. They may also be reassessing their values. You know, they've spent time at home with family. They've realized how much time they save not commuting. So people may be just changing in their sense of work-life balance and what their perception of that is. And then certainly we have people who are worried about losing their job or, you know, getting less pay. Others may have family members who have lost jobs, so that's a big concern for them. Some of your organizations may have had to lay off or furlough staff. So that is definitely weighing on the minds of employees. So there's so many things that your employees are thinking about that you need to really be aware of and consider as you're thinking through all of these things. So it is important to just get a sense of how your employees are feeling, and hopefully some of you are doing that regularly during this time. You may also decide to do a survey to understand where they are thinking. what they're thinking and where their minds are. So that's an important thing to think. So first of all, what is your overall goal as you're developing a strategy for reentry? Is it, making sure you're meeting your mission? Is it making sure your employees are safe? Is it a combination of the two? Is your goal that you want everybody to be back in the office because that's what you feel is best? What is the impact of those decisions? So that's very important to just frame everything based on what your overall goal is. And then you need to think about your organization's values. So you want your decisions to make sure they align with your values, because your employees are watching as you might say, these are our values, but then you're saying something else during all of this. So for instance, if transparency is one of your values, but you're not communicating regularly to employees, that's a misalignment with your values. Or if service is one of your values because you provide service to your local community, you need to consider that in your decision making here. And then you need to consider who really needs to be on site. A lot of times I think sometimes leaders like to see people and they feel better if everybody's near them, but you really need to think in this situation and you really need to be flexible. Does everybody really need to be on site? What work really needs to be done in your workplace? Who is essential? There might be some that really need to be there because their jobs entail things that you can only do in the office. But if other people can still work remotely, think through that and be willing to be flexible and address that. And as I said before, think about how you've managed so far in this crisis. What's worked well, what hasn't, what gaps did you have? Were you able to react quickly? I think there are a lot of lessons learned from all of this. And so I think those are things you should consider as you're thinking through your strategy. And then we talked about working remotely. A lot of employees, as I said before, might be interested in working longer remotely in the long term. There was a recent Brookings report that said about half of workers in America are working from home right now. So this has definitely changed the way we're thinking and how we've had to respond. So again, if that worked well during the crisis, think about if that would continue to work well going forward, at least in the near term. And then you need to think about your employee demographics. I talked in the previous slide about thinking about what your employees are really having at the top of their mind. So you need to think about the demographics of your staff. Do you have a lot of kids that have children at home who aren't in school or won't be able to go to daycare or camps? Do you have people caring for elderly parents? Just the different demographics of your population will help factor into your decision. And then finally, as we said before, what is the state of your staff? What are they thinking? How are they feeling?
You have been listening to The Switch, a nonprofit HR podcast on powering your people with talent management insights, best practices, and hacks. Looking for a thought partner to help you integrate talent into your mission's strategic plan? Well, the good news is Nonprofit HR has solutions to meet your unique talent management needs. Strategic planning is an annual ritual for many nonprofits. Yet, countless organizations plan for programs and fundraising without thinking about the talent needed to meet those goals and ultimately their mission. With more than 20 years of expertise under our belt and the bench strength of credentialed consultants, we partner with all mission types and offer solutions that span project-based human resources consulting and outsourcing, search, total rewards, and DEI. Join the community of social impact organizations that have trusted nonprofit HR to help them achieve their full potential through their people.
And then there are many legal considerations that you need to include in your thinking. And this is a much bigger topic. So you want to think about what your overall risk here. Risk is if you bring staff back sooner rather than later, or also just if you're not prepared. So you really need to think all of this through. I just mentioned some of these things, as I said, so that you know what the universe is of what you need to think about. But of course, there's the liability and risk related to workplace safety. So making sure people are safe. If somebody gets sick there in your space, what ramifications that can have. Complying with the federal and state guidelines, which we talked about before. Complying with guidelines related to testing. The EEOC recently provided guidance that said testing of employees would be allowed. So making sure you're following all of that guidance. One big question that I've seen a lot is people saying, what happens if somebody, we tell people they need to come back to the office, but they refuse to return to work. And I will just get into that one for a second, but OSHA does have a provision about somebody not having to work if they feel they're in imminent danger, and there's a whole definition of what that means. It's not likely from what I've read that COVID can be considered imminent danger if they feel their workplace isn't safe, but at the same time, you need to make sure they feel safe in the workplace. So that certainly could be used as an obstacle for coming back to work. There are a lot of accommodations that are required under the Americans with Disabilities Act, especially if somebody's in a vulnerable population. There's a lot of things related to people being home with under quarantine or with childcare issues that can fall under the recent Families First Coronavirus Response Act benefits. So there are a lot of things you need to think about. So while somebody may refuse to return to work and you might think, well, I'm just going to fire them, you need to think through a lot of things legally before you make that decision. And you also just need to think about how you can be flexible while still being consistent. And then Lisa's going to talk about some of the protocols you'll need to put in place within your organization, but you may have employees who don't follow those protocols. So you need to think legally, how you handle people who aren't in compliance with those protocols. I mentioned accommodations. They will be different than in the past. So for those of you who are used to having people ask for accommodations for ADA, I think you are going to see a lot of other ones now more related to COVID. So you need to be really aware of how to handle those. And, and bottom line, you just need to weigh employees' legal rights and, with their health concerns and your business needs as well. And then finally, discrimination or harassment can be an issue. So you want to make sure you're following all these things according to the law and also not discriminating or favoring one person over another, being aware of any harassment issues that could arise and any performance issues, because as you have people either working at home and there are some issues related to that, or people are coming back and there's some problems there, or people resisting, you need to be aware of how to handle those so that you're handling those legally as well. And then we also have issues related to recalling people from furloughs or layoffs related to rehiring people who've been laid off, and there'll be more discussion about that next week as well. For some of you who applied for the Paycheck Protection Program, there are some issues related to rehiring for that. And then hiring, there are some issues related to testing. Can you test applicants once you've made an offer to them? Can you refuse to return them to work? Or I'm sorry, allow them to come into your workplace if they test positive. So those are issues you need to think about. And then certainly privacy issues related to testing and other health information you may gather. And then some organizations are seeing more unions coming into play now. So thinking about that, if you don't have a union, if you do have a union, what you need to do to comply there. And then as we've all seen, there are a lot of updated benefit and leave laws that you'll need to take into consideration. And some people have also placed a hold on promotions, salary increases. Some people have reduced salaries. So what you need to do to be in compliance there. So I know that's a long list of legal compliance issues. And then finally, there will be a number of policies that you probably have updated or need to update, and not necessarily for the long term, but some may just be in the near term. We just list those there as well so that you are aware of those. Okay, and then just shifting to the next section of things you need to consider are communication and culture, which are very important, and all of this will fail if you don't think about those pieces of your puzzle. So we talked about how employees are dealing with all that is going on. We know that there's a lot that employees have had to grapple with in this period of uncertainty. So these two elements are crucial in making sure you do those effectively. So let's talk about your culture. So your culture has likely experienced some change, especially if you're working remotely, or if for those who have had to come in, it has probably changed as well because you're working under some different protocols and behaviors. And as we know, culture deals with behaviors, attitudes, and beliefs of employees. So if you're a leader and you have been handling this crisis in a certain way, that certainly impacts your culture. Your employees watch how you've handled and led your organization in a crisis, and that will impact your culture and how they feel about the organization. The way employees engage with one another has certainly changed as well. So you have probably had to be very thoughtful about how you're engaging your employees if you are working in a remote environment, or how you help them to interact with each other and how you make sure they're still feeling connected to the organization. And that's going to continue as we move into this world of maybe some are still working remotely, some are in the office, or all return to the office, but in a different way from before, because we're not going back to the same. So you will have to develop social distancing plans, and you just really need to make sure they address the needs of your organization. And then I mentioned discrimination and harassment before, and that is an important issue to really be aware of, because we've already seen in society how there is some harassment or discrimination towards some that others perceive maybe either have the virus or have some cause for the virus, or there's political stuff going on. So you just need to be aware of that and keep an eye on it and make sure it doesn't occur in your workplace. And as I said, culture is it's a big topic, and it can be a whole topic of its own with respect to workplace reentry and changes due to the pandemic. But it is important to really focus on intentionally watching your culture and nurturing your culture as well. And then finally, communication, which I mentioned, it really is key. You want to make sure you're being transparent through all of this, and hopefully some of you have been transparent during this time that you may have been out of the office, and really continuing to provide information and base that information on facts and make sure your messaging is consistent. So people really need to feel that their leaders have a plan in place and that you're worried about their safety and their health. And that is key, because if employees don't get the sense that their management cares about that, they're going to be less hesitant to come back and work, or much less to even do good work for you. So you want to let them know what to expect. Don't provide them surprises, give them notification. If you're planning on bringing people back to the office, give them advance notice so they can start processing and thinking about it. And they can ask their questions. People need strong leaders in uncertain environments. So you really need to make sure you are providing clear guidelines. They know what is going on and what they need to do. And it's very important to train them on any new protocols you may have. So for instance, if you put in social distancing measures, they need to understand how to do that, what's involved, and where do they go if there are questions. And then certainly you need to make sure those questions get answered. And that's where supervisor training comes in, because supervisors have had to learn how to navigate, the change now, where they're probably managing more remote employees in some cases, but they also need to understand how to navigate people's issues that may arise as they're moving to this return to work environment. So really practice active listening and know what the policies are and be able to get resolution to employees' concerns and problems. And then you also need to make sure you're communicating with your external parties, whether that's visitors, vendors, contractors, your clients, your members. They need to understand the protocols and plans that you've put in place as well. And then finally, as we've talked about before, it's very important to know what your employees are thinking. So listening is key. So you should regularly check the employees' pulse, what they're thinking, how they're feeling, and whether that's through pulse surveys or another survey, or you have your supervisors keeping an eye on how they're feeling. But make sure you do that, because that's very important to your plan. So now I'm going to turn it over to Lisa, because she is going to talk about the safety and physical space considerations and then talk you through reentry plans and what's needed. So Lisa?
Thank you, Alicia. The most valuable action you can take right now as employers is to put intentional thought into what measures will ensure a safe and healthy workplace for your employees. We're already seeing states begin to gradually open up, which means some of us will be doing the same. As you begin drafting your reentry plan, ask yourself, how do I keep my employees safe? What protocols will need to be put into place at my organization? Safety will most likely be your staff's #1 concern.
You're listening to The Switch. Follow along with this podcast. Download the slides and other visual materials at nonprofithr.com/The Switch.
So let's take a look at some employee protocols you should be thinking about. On April 23rd, the Equal Employment Opportunity Commission updated its guidance on the American with Disabilities Act and coronavirus, which allows employers to take steps to determine if employees entering the workplace have COVID-19 because of the direct threat to the health of others. With that said, employers may administer health screenings to employees before they enter the workplace. There are several screening options to consider if you decide to implement such procedures. But bear in mind, symptoms of COVID can be related to other illnesses or conditions, and accurate testing only reveals the employee's health in that particular moment. They could acquire the virus later. From a privacy standpoint, all information collected during screenings should be kept confidential and consistent with your practices for FMLA or other medical documentation that you do currently. Health screening questionnaires are the least invasive of the options I will review today. The purpose of the questionnaire is for the employees to self-assess their own health condition and attest that they have not recently been tested positive for COVID or around anyone who has the virus to their knowledge. This will require your employees' self-awareness. The second screening option are temperature checks. So some office buildings are conducting these checks on individuals entering their building, so you may have to make a decision if you'll complete a secondary screening once employees make it to your office space. However, the building may have a mechanism like color-coded wristbands that indicate a passing temperature, which may be acceptable for your planned protocols. If you conduct temperature checks, have a plan on how you privately report to an employee if they have a fever. You shouldn't do that in an open space. Also, you will need to have guidelines in place for how long symptomatic employees are required to self-isolate or quarantine. As developments occur around symptom response, using the guidelines put out by the CDC and your state officials are your best options. In fact, the CDC now has an interactive self-checker tool to help employees make decisions and seek appropriate medical care. This is a tool that you can share with your employees. The last option is requiring your employees be tested. Right now, we are seeing the availability and accuracy of testing fluctuate. So you'll want to check with what testing services your state and/or district is offering. The CDC has advised individuals should contact their health provider first if they want to get tested. So depending on what personal protective equipment states mandate workers to wear in the workplace or what you will require, employers have an obligation to provide a safe work environment. If your organization will require your employees wear PPE, which can range from face coverings to gloves to gowns, you will need to provide the equipment for your staff. It's imperative that you survey the exposures to your staff and decide what best suits the organization, as Alicia mentioned prior. As an example, if your employees have physical contact with the public, you may require them to wear face masks, face shields, or gloves. Organizations should follow at a minimum their state and/or city guidelines. Remember, there is not one solution that will work for every organization. However, adhering to guidelines of government and health officials is strongly advisable. So we've all had several weeks of practicing social distancing in public. However, when we return to our offices, we may naturally head into the kitchen, grab a cup of coffee, and congregate with our colleagues. The new normal will be a mindset and cultural shift for all of us. Here are a few items you'll need to consider. How will you enforce 6 feet spacing between individuals? How will you limit social group gatherings? The federal guidelines mandate no more than 10 people should congregate. Another aspect of social distancing is interactions among colleagues or external individuals, which brings me to the personal greetings, more specifically, handshaking. I would encourage you to use this as an opportunity to have some fun and exercise creativity. Implement a department challenge to see who can come up with the most creative virtual handshake and award the winners. We'll discuss later how to best incorporate social distancing measures. Organizations will also need to think about business travel protocols. Will you suspend all business travel or just non-essential travel for a period of time? This is the time that you need to contemplate alternatives to business meetings, conferences, and the like. Some conferences are now switching to virtual platforms such as Global Meet, and business meetings are being conducted on platforms such as Microsoft Teams and Zoom. Pre-COVID, organizations were not particularly concerned about the travel plans of their employees. However, you can start thinking about how you will respond to those employees who have disclosed to you that they will be traveling to an area that has travel restrictions due to COVID. Will you be flexible and allow the employee to self-isolate at home while working before re-entering the physical workspace? So this is a great time for you all to encourage transparency from your employees as you exercise the transparency that Alicia mentioned prior. So let's take a look now at some worksite protocols that you may consider implementing in your re-entry plan. If your building is managed by a property management company or you have your own building, You'll want to liaison with the facilities team or inquire from the property manager on protocols put in place for anyone entering the building that support the well-being and safety of everyone. To properly assess a safe environment, inquire about assessments being conducted, such as air filtration and circulation, as well as ventilation rates to ensure good air quality. Find out how often they're cleaning their lobby desks, their floors, the elevators, and restrooms. Are they screening everyone coming into the building by performing temperature checks or some other form of screening? How are they responding to their own staff who test positive for COVID or those exhibiting symptoms? Are they limiting package deliveries and pickups? Some of their responses may require you to put procedures in place or revise what you are currently doing. So depending on the size of your office and the layout, you may have to put up signs necessary that will help with social distancing and health safety. Some of these signs may include one-directional hallway floor markers or prevention posters on how to stop the spread of germs. The CDC offers a variety of complimentary downloadable posters on their website. Because we know the virus can spread through surfaces, consider increasing your regular cleaning schedule to once or twice a week to keep high-touch and common areas clean, as well as providing hand sanitizer, tissues, gloves, and office cleaning supplies for daily self-cleaning. You may encourage your staff to wipe down their desks upon leaving for the day or using disposable desk mats, which they can discard at the end of the day. As a reminder, it may be a good idea to avoid communal meals, so hold off on those pizza parties for a while. One of the goals of your reentry plan is to limit potential COVID exposure to your staff. For those who typically have visitors in their office, you'll need to decide if and when they will be allowed back into the office. If they are allowed back in, what protocols like temperature screening will you put in place? This goes for delivery services as well. You can check with your property management company to inquire if your packages can be received by lobby staff, or if you don't have a property manager, speak with your delivery services on alternative methods of receiving and picking up packages. Don't forget to implement protocols for disinfecting the incoming mail. Now, let's discuss some plan updates that you may have to make and best approaches to managing information and responses to COVID issues. To ensure you're making informed decisions while understanding the needs and concerns of your employees, we recommend you implement a COVID response team if you haven't done so already. These individuals are responsible to really being the ears and eyes of everything COVID and maintaining one consistent message throughout the organization. Some key players you may want to include are the heads of the following departments: HR, operations, facilities, communications, marketing, and the organization's leader. One or more of these individuals should act as the primary spokesperson for internal and external questions and concerns. And this really depends on your organizational structure. As a result of the pandemic, you may have seen some gaps in your current business continuity and emergency response plans. For some of you, your organization may not have had these plans in place, and decisions were being made quickly, and some of these decisions could have been more informed. This is the time to revise your plans, and if you don't have plans in place, develop them. Don't forget to continue revising the plans as things evolve. Before we take a look at the preparation steps of a re-entry plan, I want to quickly review what re-entry means, as it may be different for each organization. There are three types of re-entry we will see among organizations. The first one would be the actual physical workspace opening back up. The second is returning from a complete shutdown of one's business. And the final one is recalling of furloughed or laid off employees.
You have been listening to The Switch, a nonprofit HR podcast on powering your people with talent management insights, best practices, and hacks. Looking for a thought partner to help you integrate talent into your mission strategic plan? Well, the good news is Nonprofit HR has solutions to meet your unique talent management needs. Strategic planning is an annual ritual for many nonprofits. Yet, countless organizations plan for programs and fundraising without thinking about the talent needed to meet those goals and ultimately their mission. With more than 20 years of expertise under our belt and the bench strength of credentialed consultants, we partner with all mission types and offer solutions that span project-based human resources, consulting, and outsourcing, search, total rewards, and DEI. Join the community of social impact organizations that have trusted nonprofit HR to help them achieve their full potential through their people.
I'll share a three-phased approach that is intended to mitigate risks and protect staff. Your organization may find that a four-phased approach works better. Remember, each organization is unique, and we will all have our own unique approach to physically re-engaging our number one asset, our employees. Before we discuss the phases, let's take a look at what you can do to prepare and plan effectively. So the first step is to really develop this reentry plan. The plan is intended to slowly and safely integrate employees back into the physical workspace using the protocols we've discussed and others that I will go into. At this juncture, you'll want to have your COVID team in place that I mentioned earlier. Remember, you want employees to know that they are being heard and the organization is putting their well-being first. So getting your staff's input on a return to work plan is essential. Through a survey, you'll want to ask questions like, what is your level of concern returning to the office full-time? Or how would the office need to operate for you to feel comfortable? If you take public transportation, are you comfortable using it to commute to the office? And finally, do you have any personal concerns working from home or returning to the office that you would like to share? So this will kind of help you gauge what your employees are feeling. So consider some of these factors when deciding who will return to the office in each phase. And I know this is a popular question that employers are really asking now. So here's some things to consider. What roles and responsibilities can remain working remotely in each phase? So for example, your facility staff may be considered essential and return in phase 1 to ensure the safety of employees. Secondly, which employees are most vulnerable to the virus or live with people who are? You may want these individuals to continue working from home. And thirdly, which employees have personal circumstances at home which they would need time to resolve, such as childcare or elder care. Also, remember, eligible employees may use leave benefits they are entitled to through your company's leave programs or mandated programs like FMLA or the new FFCRA. You may have employees request leave if you require them to return to the office during a time they are uncomfortable or have personal circumstances that hinder them from returning. So have a plan to address that. To reduce the number of employees in the office at one time, consider staggering your work schedules. So perhaps you divide your employees in 3 to 4 teams, depending on the size of your organization. Each team could be assigned on-site work days and start times. This will support social distancing and ensure that you have a ready workforce in the event of an outbreak in the office. Some organizations may opt to provide a subsidy for on-site parking to avoid their staff from using mass transit. Also, have a plan to deal with an increase of vacation requests occurring at the same time in order to ensure your business operations are not negatively impacted. And this is going to look different for each organization. Some of you may have already had to put plans in place to respond to employees who are exhibiting COVID symptoms or even those who have COVID. In any event, we recommend you follow CDC's guidelines. If you haven't done already, have employees' response communication ready to go, as well as exposure response communications to those that may have come in contact with an employee who exhibited COVID symptoms. It is advisable to have your entire office deep cleaned before employees return, especially if you have employees going into the workplace on an ad hoc basis during your temporary office closure. Depending on your office layout, you may need to make modifications to workstations, conference rooms, and common areas to ensure social distancing, like removing chairs or tables or even reorganizing desks. And as I mentioned earlier, ensure your building has conducted a thorough assessment on the air quality and filtering systems throughout your building. And lastly, make sure you order your hygiene and your safety supplies now if you haven't done so already. And this is because some of the items will be harder to get due to high demand. So now let's take a look at the 3 phases of reentry and what is recommended in each. So phase 1, this is where your workplace will be open for your essential workers. Remote work would continue for your non-essential employees. You would implement the staggered work schedules. You would also implement the safety procedures that we've discussed already. You would have your COVID team report back on what is working, what complaints have been received to assess your organization's readiness, and what measures have been taken to address the issues. During this phase, you should also restrict business travel, visitors, and on-site deliveries. Provide planned protocol training to supervisors and those on site. Supervisors should be well versed on how to handle employee complaints and also the new protocols. And lastly, act on employee concerns immediately as they arise. Employee complaints about perceived safety issues should be taken seriously and investigated, and you should not take any retaliatory action against employees who make such claims in good faith. Before you move to the next phase, take time to fully assess how well the plan is working before you move to the next phase. Some may need to wait 2 weeks in between phases, and some may need to wait 4 weeks. Just depends on how well your plan is working. Phase 2. So in phase 2, you want to maintain what you're doing in phase 1. This is where you would be bringing back a limited number of employees, and you will also be making changes to the plan based on the results of your readiness examination that you did in phase 1. And remember to continue surveying employees on their comfort level, what's working well, and what the organization can do better. Those are the types of things that you want to hear from your employees. And finally, phase 3. This is the phase that you would bring back all of your employees. You may find it necessary to include some of what you're doing in phase 1 and phase 2, but it really depends on how well the phases are working again. In this phase, there would be no state or federal limitations or restrictions, and you may keep remote work optional if you don't have this flexibility already. And this could be really beneficial in a rebound occurrence. And you may also decide to maintain remote work as a standard practice. And lastly, as best as you can, accommodate the personal needs of your employees. This will go a long, long way and may be the very demonstration of empathy that keep employees happy, motivated, and engaged, a testament to your work culture. Before we get to questions, I would like to wrap up with some key takeaways. Number 1, consider what is appropriate for your organization. Remember, one size does not fit all. 2, develop a plan with input from your staff. Identify roles and responsibilities related to each reentry phase and prepare your workforce now. Be aware, acknowledge employee behavior and well-being. Really have an honest sense of how each staff person is doing. Revisit your plan regularly and prepare for a rebound of the virus, as we don't know right now what will happen in the future. Be agile, be flexible, and be compassionate. And lastly, communicate and lead. Employees thrive with strong leadership. So here are several links to resources we hope that you find useful. They include a comprehensive back-to-work checklist from SHRM, also CDC's step-by-step guidance to reopening your workplaces, CDC's guidance for cleaning and disinfecting your offices, and lastly, Nonprofit HR's Coronavirus Digital Information Portal, which you'll find a lot of information on.
You're listening to The Switch. Follow along with this podcast. Download the slides and other visual materials at nonprofithr.com/The Switch.
Now, let's move to Q&A. Mishka, what questions do participants have for us?
So we have a few questions here for you. Here's the first. What accommodations can I offer staff for additional expenses related to returning to work? So whether that be transportation, childcare, additional food costs, etc.
Thanks, Mishka. I'll take that one. Some employers, what we're seeing some employers offer are a parking subsidy, and I actually mentioned that during the presentation. So it's a parking subsidy to allow them to park, near or at the office, and this will help keep them from using mass transit.
Great, thanks, Lisa. Alicia, did you want to add anything to that?
No, I think people are getting creative as to what they need to supply for staff, and I think you just continue to be flexible and think through what makes sense as you go forward.
All right, we have a second question here. We are a nonprofit organization serving individuals with disabilities and special needs. We have a lot of volunteers. Can we have different policies for employees versus volunteers? Should we consider an additional release form for this particular risk?
Yeah, so I know a lot of you grapple with volunteers in your organizations and what do you do with them. And I imagine during this recent time, some of you have had to kind of retool your volunteer programs, whether you ask your volunteers not to come in or if you take a break with your volunteers or restructure what they do. So I think people really do need to think about how they treat their volunteers and think about them in the same way as their employees in terms of the safety provisions. So you want to make sure that you put the same safety protocols in place for your volunteers and that they understand those protocols. You may need to restructure how they work. You may, need to find more projects they can do remotely. You might need to schedule them in shifts, just as you might have to do with your staff. You might need to do, some training online for them. If you have a training program that requires them to come on site. If they're working directly with members, you might have to curtail that temporarily or put them into small groups. But the biggest thing is, again, making them feel safe just as you would with your employees. So making sure they're communicated with, they know what your plans are, what you're doing, and what is expected of them.
Thanks, Alicia. Here's another question. This fall, we're scheduled to hold a conference of about 60,000 attendees and 50 events with over 500 attendees around the US. If the government restrictions allow events of this size with social distancing, how do we respond to staff that is too scared to travel or work?
So I think that if you have staff that are afraid to travel, most likely your attendees are going to have the same fears. So I would encourage you really to rethink holding the event. And if you absolutely have to hold that event, ensure that, the safety measures that some of them that we talked about today, to really implement them. But what I have been seeing, and I think some of my colleagues have been seeing as well, is that people are rescheduling. They're postponing some of these, in-person conferences just to, mitigate any risks with the virus.
Yeah, and I would just add that I think some organizations are also figuring out how to do these virtually. But if you're figuring out how to plan one of those, you have to put a lot of safety protocols in place for your attendees, and those would apply the same to your staff. So everybody would have those same concerns. So I agree.
Another question here. Regarding our staff, we have a mix of frontliners and office staff who are remote. Have you seen best practices on employee engagement techniques during the pandemic with different employee populations?
Definitely trickier when you have a mix of both. I think certainly those that have been having workers work remotely have really worked to come up with some creative ways of keeping people engaged. A lot of it mostly through video means. That's a little bit harder when you have your frontline workers. But I think it's important to make sure that you don't have that divide between the two groups and are able to get those people together. So your frontline workers may also, if you give them the ability somehow to connect with your office staff so that everybody feels that they're part of one team. And certainly I think it's helpful for the frontline workers to be able to share what they're facing with those that are maybe working remotely, and the remote workers finding out what that frontline staff needs and can respond to them so that they feel like they are supporting them as well. And I don't know what you have to add to that, Lisa.
Yeah, I would just add some of the things that I've seen clients implementing. So I've seen virtual happy hours. I've seen virtual bingo night, also workout groups, because I think it's really important that we stay healthy during this period and not, stay stationary at our desk all day. And then too, really having those regular staff meetings to keep people engaged and to keep people, I think there's a difference when you see faces. So if you're doing the staff meetings, make sure that you're using the camera to really connect with folks. And then the last thing is our book clubs. So I've seen some clients use or implement book clubs, and that's really going well.
Yeah, and I would just add to what both of us said. If you have frontline workers, they're certainly dealing with a lot of stuff directly. And while everybody, is having issues that you need to think about, everybody's mental well-being, but frontline workers in particular, maybe really making sure that you're listening to what they're experiencing and how they may be feeling, and making sure they get breaks from some of the work they do, depending on the type of work they do as well.
Okay, thank you. So moving away from engagement, we have a question here on how much advance notice would you recommend we provide employees?
Some of the articles I've read talk about, a couple of weeks. I mean, it really depends. I think as much as you're planning and you're hearing, keeping your staff informed, like we hear that our jurisdiction says that offices can open during this time. Here's what we're thinking. But I think, as much notice as you can give them so that you're not telling them, okay, today's Friday, on Monday, I need you to report to the office. People obviously have things they need to get in line before they can do that. Plus they need to mentally prepare. Plus they may have some issues and things they need accommodations for that wouldn't allow them to do that. So I think from both sides, unless there's an urgent need to be back in the office, I think you need to be able to give them a little bit of time. Somewhere around 2 weeks seems reasonable, but I'm sure it depends on the circumstances.
Thank you, Alicia. Here's another question. Regarding reentry plans, what if people don't feel safe coming back to our physical office? Should we treat this like we would a workplace accommodation?
Yes, I would say that, there are going to be people who have certain circumstances, fear being one of them. So as best as you can, try to accommodate those employees. If their work can be done remotely, if you can't allow them to work remotely, like I said, this is going to be on a case-by-case basis, and it really depends on the business needs of the organization. But during the time of trying to make decisions like that, be agile, be flexible, and be compassionate with people's circumstances.
Yeah, and I think, you have to be aware, as we kind of mentioned briefly in the legal section, that people may have reasonable accommodations that may need to be requested, and you really need to go through that interactive process, at least HR should, of understanding what those needs are. They're medically related, getting the information they need, but going through that process and really helping them articulate what they need and why. And sometimes, if they have a fear, trying to understand, is there something specific that would alleviate it, or is it just a general fear? And really just helping them to get a sense that, the conditions are safe, but if they have particular reasons that make sense that they can't do that, then that they go through the process of requesting that accommodation. You truly evaluate that and determine whether you can indeed provide that accommodation.
So we have a couple questions around what Lisa mentioned about checking the pulse of employees before returning back to work. The first one is, how do we determine who is most vulnerable? Do we need to ask employees this? It feels a bit invasive.
Well, I would say, make it optional, right? Make it an optional question. Some of you would know, some employers would know if their folks have, childcare, or they have children through, dependent care programs that they may have implemented. Let the employee share what they want to share, but I would ask it in a general way to say, do you have circumstances at home that would, prevent you from returning to work if we return to work in the next 2 weeks? But just kind of leave it open, an open-ended question.
All right. We have another one here in reference to that kind of pulse staff survey again. Are you aware of any lists of questions that are recommended that people ask on these pulse surveys?
I'm not aware of any list, but I think that we can share that on our resource link. We can share some questions that you can ask your employees. We'd be happy to do that.
Yeah, I think the key is getting at, what is concerning them right now. So maybe even getting a sense of what they understand and don't understand, because sometimes you think you've communicated things to staff in a staff meeting or in an email, and yet they still have concerns or maybe heard something different. So really understanding what what their thinking is, what their understanding is of what you've said, and then what are some of the things, maybe what concerns you most about returning to the workplace. And then you'll get a sense of, okay, 50% are concerned because their children are at home, or 80% are concerned because they're worried they'll be infected. So then you really know where their thoughts are coming from, and you can make plans to help address those, or certainly get back to them and respond to those kinds of concerns.
All right, so we have another question here, and this is based on different policies for staff and regular consultants. Would you recommend different policies for full-time staff versus consultants?
Well, I think if you have consultants that are actually on site, they'll need to follow some of the same protocols and provisions that you put in place. If you have consultants, obviously, that are not in your workplace, that won't apply as much. But certainly your employees are your employees, so you have that legal obligation to them, and they follow all of your employment policies. So that is a distinction there. But if you have consultants on site, you want to make sure you are ensuring a safe workplace for them as well. And for instance, if you tell everybody to wear a mask to work, then they should also have to wear a mask to work. So you do need to have some consistency there.
Okay, great. And so for our last question, we have an attendee who's curious to know if either of you have heard any feedback from nonprofits in states that have already reopened. If so, are there any takeaways for those of us who are still closed?
I have not yet. I don't know that our firm has yet, but we'll be keeping an eye on that, and maybe some of the data from our survey or some of the comments will give us some information about that. I think some have just started to reopen, so I think we're still in the early stages of that, but it will certainly be helpful and inform, I think, a lot of what others do. So as we get that information, we'll certainly be happy to share that out as well.
Yeah, I agree with you. And I think, our next Pulse survey, we'll be able to gain an understanding of what's working well and what's not.
Yeah, and I think also just, time will tell on everything, because as each area of the country has different circumstances, as we go on, things could change. So your circumstances may be good one day, but that could change a week later, and you may have to adjust. So I think one of the other big takeaways is, and it was listed and Lisa mentioned it, but is really being flexible and developing a plan that allows for that agility that you can shift. So you need kind of a plan A, but you need a plan B and a plan C. So you may have all your plans in place, but then you get data from the government or from public health organizations or whatever that's going to make you have to shift and maybe go back a phase or something like that. So I think being agile and flexible is very important in this process.
Well, that's our show for today. Thank you for listening in to The Switch. Does your organization need to talk with someone about the topics we covered today? Nonprofit HR is your thought partner for all talent management lifecycle needs. We've served the social sector exclusively for more than 20 years. Call us 202-785-2060 or email us for a mini consult. info@nonprofithr.com. Looking for more episodes of The Switch? Visit nonprofithr.com/The Switch and access recordings and resources to help your organization maximize its greatest asset, your